Hello and welcome to today's live broadcast. We are live today with one of our title sponsors, Ryan Sturdivant with Recovery Ways. So we want you to stick around to learn a little more about their program and the great work that they do. But if you haven't already heard, A Way Out is going digital for our 2020 conference. Yes, we've had an amazing event in person, but this year we are going digital. And we've lined up 3 internationally renowned speakers, Dr. Michael Barnes, Dr. Judith Grissel, and Roquel Lerner, to talk about improving outcomes from addictions. This is a 3-day event, September 29th, September 30th, and October 1st, with an October 1st panel discussion from 2 to 3 p.m. So if you'd love to register for this event, please click up in the post description to register for that. So without further ado, I'd love to bring on Ryan Sturdivant with Recovery. Well, hello and welcome to the broadcast today. We are live with Recovery Ways and National Director of Business Development, Ryan Sturdivant. Ryan, why don't you go ahead and introduce yourself to anybody that doesn't know you, what you do, and what Recovery Ways does.
Sure. Well, Danny, thank you for the opportunity, and privileged to have the opportunity to kind of address anybody out there that wants to learn more about Recovery Ways. So yes, Ryan Sturdivant is my name. I work at Recovery Ways. I am the National Director of Business Development and have a few different roles that coincide with that. I'm also a clinician, got into the field, been around this field for about 11 years. And really kind of navigated over to develop because it allowed me to mold mission and the helping families and the business development side together. So what I like to tell people is, yes, I work on business development side, but I bring my clinical experience to that. And I like to think that I bring the ethics and the integrity of being a clinician over to the business development side, and really try to bring kind of some integrity back to this side of things where I feel like we've been missing that piece a little bit in our industry. And then Recovery Ways, Recovery Ways, there's so much to say, and I know we don't have a whole lot of time today, so I want to touch on all the key points. First of which is, we've been around since 2010, so going on 11 years. We are Joint Commission accredited. We're part of NATAP, all of those things, the accreditation bodies. And then really kind of the hallmarkers that I just want everybody to take away and make sure that you hear is, we have kind of built our reputation over the last 10 years as being a trusted partner in the addiction and mental health field, and especially in the last few years have really gained name recognition nationally for co-occurring capability. So treating both the mental health and the substance abuse piece of that, because we are licensed for both. And some exciting news is we are just launched our mental health only program. So people do not need substance abuse to have substance abuse involved in their story in order to access our care. And the great thing is we do it at an in-network rate if people need to utilize their insurance. And we also have very competitive kind of rates if people want to pay out of pocket for our services. So that's kind of the quick rundown, but I'm sure we're going to get into more with you, Danny.
That was a fantastic high-level view. A few things to remember. There aren't tons of programs out there that are truly co-occurring, and then now have an entire program dedicated to primary mental health. Now, this is a big deal because oftentimes you'll get calls as a substance abuse treatment center, and there may be some primary things that you couldn't always handle before. Now you have the ability to handle those primary mental health issues. But as we know, the reason we use co-occurring is because lots of times these things are kind of together. We don't often see one without the other, and that's a good reason why I love that you guys have opened that up. When it comes to being in network with most insurances, that's a big deal because what keeps most people away from this side of thing is access to care. So being in network, allowing people to use their insurance as a benefit and give those sort of out-of-network benefits is huge. And what does it mean that you're a platinum member of UHC?
Sure. So back in 2017, United Healthcare rolled out this program that really vetted all programs across the country when it came to substance abuse and mental health. They with their own benchmarks, they deemed Recovery Ways a platinum provider because we were hitting their benchmarks. They didn't tell us about these benchmarks, Danny. They just said, we're doing this research, collecting this data, all these different things. And at the end of their study, basically, they came back to us and said, you're in the top 5 percentile of treatment centers across the country for cost, length of stay, readmission rates. We have a 5% readmission rate post 90 days of treatment to a similar level of care or higher. Meaning, so what information that we gain from that is that when people come to Recovery Ways and they go through our program, the skills and the things they learn here sinks in, and we see a far less readmission rate back into a program after they leave us post 90 days. And the greatest thing about this data that United Healthcare was tracking is we have nothing to do with it, meaning they're pulling their individuals that have United Healthcare in and out of network, and they're comparing it across the country. And so it's not us collecting any data. It's not our data. They're collecting it, and they're like, and what they've gained from that is you guys are doing something right, and your cost to treat individuals is far less than what we're seeing on the national average, and people are getting better far more than what we're seeing on the national average. So it's really something to be proud of. Another aspect some area we were missing, and we always appreciate that because we want to know how we can do better. As you know, we haven't done a great job in the industry of moving the needle, right? The outcomes have not really improved steadily as we would hope they would. And so having this data gives us a chance to look at what we're doing and how to improve that and hopefully move the needle the other way so our outcomes become better. So patients are having to seek out treatment far less. They have less time away from the job, family, all those different things, if we're getting it right, the first time, hopefully. That's our hope. And we just, and that's kind of the important thing of why we kind of created the mental health only program, is because, we want to go where there's need. We want to move the envelope. We want to, or push to there's gap and see what we can do to improve those outcomes. So if somebody comes into our program and has a mental health primary diagnosis, they could still be appropriate for our co-occurring program. But we look heavily on the individual and what their needs are, what's going on clinically with them to determine where they're going to be a best fit, who's going to be the right clinician for them to work with them, who's going to be the right psychiatrist that we have on staff, because we have 3 psychiatrists on staff, 2 of which are board certified addiction psychiatrists. So, we want to pair these individuals with who is going to be the best fit moving forward, because a lot of times what you see is people just get paired with who has a smaller caseload or something like that. And then 3 weeks in, the individual gets their voice back and starts saying what they need, a big part of the process. And then your time with them is almost up. And so we try to really put a lot of emphasis on the front end of getting people to where they need to be first and foremost. And then I think that really ties into kind of the outcomes you see with us.
Yeah. And when you talk about getting people where they need to be, that was something you were so passionate about when we talked. You're not just waiting for that phone to ring to say, oh yeah, hey, we got room for you. Yep, we got a bed next week. Come on in. We'll talk about it. This is very purposeful to say, what's going on? What's going on in your life? You're wanting to make sure that wherever this human being needs to land, they land. This isn't about how many people can we get through Recovery Ways doors. This is about, well, from what I'm hearing, this might be a great program for you. And the one thing you're so passionate about, Ryan, is building these referral partnerships across the nation to make sure that these families who often reach out this first time with that confidence, that they get pushed in the right direction and they get the best treatment that they can. And one thing I also want to give you props is that UHC thing. as we know, insurance companies are about how can we get someone better with the least amount of money possible. At the end of the day, it's no secret, we know that they want to offer care at the least cost. And what they're saying out loud for anybody that doesn't understand insurance is that Recovery Ways is able to get people better at a cheaper cost than everybody else and make sure they get past that 90 days, which is so crucial in recovery. So really hats off to you guys for what that means is you are doing what matters up front for the right reasons to make sure that those people get there. And I'm so glad to see that you've won that award and you're a platinum member. That's a big deal.
Well, thank you. Well, and we put so much emphasis on our clinical program here at Recovery Ways, and so and we're really proud of that. We want to invest in our clinical program and build that up. We like to say we're an in-network facility. We have out-of-network experience at an in-network rate, right? Or an in-network experience. So,
yeah.
And I know I just screwed that up or fumbled over the words a little bit there, but hopefully you understand what I'm saying. Like you get a lot more from our in-network facility than what you normally see at in-network facilities. And you're right. When you talk about the partnerships that we've developed nationally, that is something we're very proud of and I appreciate you giving us props, because one of the things that I'm very proud of is the fact that, when the family calls me for the first time, or any of the people that work for Recovery Ways and on our team, we first look at where is this person going to be most successful. And if that means sending them to somebody else besides Recovery Ways, we are happy to do so, because at the end of the day, that's all that matters, is that people are getting better. We don't just look at somebody and call them up and say, hey, we have Blue Cross Blue Shield, are you in network? We say yes, but we're like, hold on a second. We want to make sure that you're a good clinical fit for us first.
Mm-hmm.
So, that's very important to us, and it fits with how we view ourselves and how we feel like we conduct ourselves. Is just quality care at an in-network rate, but quality care, putting patient-centered first, and making sure they get to where they need to be. And that's kind of why we're a trauma-informed facility that really takes, really tries to be not just talk and teach and push, but really listen. And I think that's so important when you're dealing with people that have had trauma or traumatic experiences in the past, are dealing with the substance abuse, the mental health piece. And we have some very unique things that we tie into their treatment. So if you end up going to our website, obviously, you'll see unique things that we do that are kind of unique to Recovery Ways as a whole, that you rarely see in the industry, which is, like our sensory integration and occupational therapy. We're one of the only treatment centers across the country that have utilized occupational therapists and sensory integration to help people kind of make that brain-body connection that I think oftentimes gets missed in treatment. We also do some other unique things with our rec therapy department. Salt Lake City is nestled right along the Wasatch Front. So we're about 15 minutes from, 4 major canyons here. And so we have a huge rec therapy team. And so one of the important things to us is to get people out in nature, get them connected to whether it be their higher power or just show them how to have fun again. And we have rec therapists, a team of 8 rec therapists here at Recovery Ways, so that is vital. So not just taking them out on group outings and stuff like that, but we do a lot of individual rec outings with individuals as well. So just some other unique things about what we do.
Yeah, and I know as somebody who's a national director of business development, but you're also a clinician at heart. It really stood out to me how great you talked about your staff, how they are so special treating co-occurring disorders. Talk about your staff and, why they're so special with really dealing with these co-occurring disorders.
Yeah, no, absolutely. I mean, we feel very blessed here at Recovery Ways. And this goes back to talking about really investing in our clinical program. So we have, like I mentioned earlier, we have the 2 board certified addiction psychiatrists on staff. We have another psychiatrist on staff as well that's, here full time. We have family practice MD that's an addictionologist on staff full-time, 24-hour RN nursing in detox and residential treatment, and then all of our clinicians are master's level clinicians or above. We have staff that just kind of have worked at Recovery Ways for years and just don't want to leave, that have their doctorate and stuff like that, that just kind of hang on and hang around, as contract workers, because they're like, well, I just don't want to retire from Recovery Ways. I don't want to, because we have so many staff that have been here for, 5, 7, 8 years. And we've only been around 10. And so these people have come and they've stayed and they've wanted to be a part of kind of the good work we're doing. Which is, I think, a testament to the program itself, that people end up staying and hanging around. I personally have been here almost 4 years. My sister also works for the company, and she's been with them over 5 years, coming up on 6. So we're just really proud of the program we put out there. And one of the things that, how I kind of evaluate different programs, because I've toured hundreds across the country, is, would I send my loved one there? I have a loved one that's went through Recovery Ways, but I've always said that I would never work for a program I don't believe in, and that's just the clinician in me. I have to believe in the work we're doing, and I'm still here. So I just know, day in and day out, we're putting our best foot forward.
That's awesome. And we're going to talk about where you're moving now. So you've 11 years, you've done great things, but you probably learned a lot of things. One of them being you launched this mental health only program. Another being you're really expanding into these outpatient centers all across the country. Talk about why it's so important to have this mental health program, and also why it's so important to expand all these outpatient centers.
Yeah. So, I mean, obviously with COVID, we're kind of in unique times. I think the last I heard was alcohol consumption or alcohol sales went up 200% at the start of COVID, something like that. But what we're seeing more and more is we're seeing more acute mental health needs, and more people that maybe it's not so acute, but that are really struggling in these times of COVID and kind of social unrest and all the different things that it's hard to even turn on the news these days, right? But so more and more people need that specific mental health piece, and combined, with the mental health, a lot of people are obviously turning to drugs and alcohol too in these times. And so to have a program that has that true co-occurring capability is so vital right now. And, we wanted to expand into outpatient. We're not, Recovery Ways are kind of our hub is right here in Salt Lake, but we wanted to be able to expand and create more access to care for individuals in underserved areas. So like right now, our biggest thing is removing barriers for people's access to care. And so we are, we just opened up a program. Well, a program came under our umbrella. Breakthrough Recovery up in Spokane, Washington, came under our umbrella. They've been around for 7 years in that community, and we're doing great work, and wanted to partner with us because we're already working together. And so we have different programs like that coming online where we can actually partner with them. They're a sister facility now, and we can help them kind of grow kind of their mental health program, grow their ability that we're seeing all the time with maybe medication assisted therapy stuff. So just really trying to beef up the programs that are already existing, already doing good work, and already have a good reputation, but kind of bringing them into what we feel like is a clinically sound program, and move forward to treat more people together.
Yeah. And Recovery Ways is located in Utah. But the one thing to know is you get people who come to your program from all across the United States. And what's also important is that if I'm somebody in Ohio and I want to fly to Recovery Ways in Utah and I want to complete your program, well, what if I love Recovery Ways so much, you affected me in such a great way. What if I want to go back to Ohio and I want to stay with the Recovery Ways program? That's an added benefit as well to your clients, right?
Yeah, so not only do we have like a virtual outpatient right now that we're conducting if they would stay in the contact care, they can do our virtual IOP from Ohio, if that's where they're going back. The other piece is our alumni program. Our alumni program is huge. Our focus is to keep people connected to Recovery Ways. Here in Salt Lake, we're putting on, 2 to 3 events weekly. We have our big alumni reunion, which was all virtual this year, of course. We try to keep people connected as long as they want to stay connected to us. So we have our alumni team that actually reaches out to individuals for up to a year after they have left our program to try to keep them connected. So it's just these small things. We have an app that we've developed just for our alumni so they can stay connected to each other and gain resources and different things like that. So we're just constantly trying to add more because we want people to be successful and we want to see them do well. And, one of the biggest outcomes for people's success is keeping them connected to some level of treatment, whether that be outpatient, whether that be AA, and that's another thing. We are not, we often get the question in Utah, are you affiliated with any religious organization? And so I think we only get it because we're in Utah, but we are not affiliated with any religious organization, but we will do whatever the client finds supportive. So that's why we offer 12 steps, refuge recovery, smart recovery, celebrate recovery. We want all paths to recovery, and whatever is going to support the individual, we will support. But we are non-denominational. We don't have any religious affiliation, but really what we focus on is kind of that well-rounded approach of healing the mind, body, and spirit, whatever that might look like for each individual client.
Because it is deep, it is different for each individual client, and you do have that care set up for each client. So, if anybody's interested in connecting with Ryan, so Ryan is the National Director of Business Development. He's also a clinician. If you're interested in learning more about the program at Recovery Ways, or you love to share more about your program or your private practice to really connect with Ryan, then please reach out. Ryan, I'll probably ask you to maybe share whatever contact information you're comfortable with in the comments below. But if you want to learn more about Recovery Ways, visit recoveryways.com. Here you can find more about their programs, more about what they stand up for, and you can call to talk to an expert. And like we said in the beginning, really start to get your questions answered. And again, they are in network with most major insurances, which is a huge deal because then you can utilize your insurance benefit to get the treatment you or a loved one needs. So Ryan, really just want to thank you for your time today. Thank you for adding value, and really thanks to Recovery Ways for being a staple in the industry and really knocking out of the park these outcomes.
Well, Danny, thank you so much for the opportunity to share a little bit about Recovery Ways. We're really proud of what we do here, and so we're excited. And please, anybody that wants to learn more, I'll put my contact information, my cell phone number, and my email in the chat. And then you can also find my information on our website. So all my contact information will be there as well. And I would love to chat with you and see how we can work together. And really, just if you need resources, that's the other thing. We have a national team that we can connect you with resources if you're looking for an individual therapist, treatment center, whatever that might look like in your area. I'm sure we have somebody that we can connect you with if that's what you're looking for. So
fantastic. So I just put your phone number below, and now your email is up on the screen. So shoot an email, connect. He'd love to network. So again, thanks today, Ryan, and you have a good rest of your day.
You too. Thank you, Danny.